our dietitian at Samaritan Pacific Communities Hospital recognized that patients who were malnourished tended to be readmitted to the hospital more often because they were unable to really heal because they didn't have the nutritional supplements to do that. So we created a protein prescription program so that we could provide food to those patients who are food insecure, and that is the root cause of their malnourishment. We received a grant in order to kickstart the program, and then protein prescription became a regular fund that people can donate to now. We also expanded the program from inpatients to outpatients so that we could try to prevent people from being hospitalized in the first place. Then we worked with JC Market in Newport, and they created a program for us where they provide us with vouchers that we can then give to our patients, and our patients can take them to the store and redeem them for groceries. Once the pandemic hit, then we realized some of our patients couldn't come in for their appointments, so we weren't able to give them the vouchers or recognize whether or not they had this need. Some people were unable to get to the grocery store and pick up food, redeem the vouchers. So I had spoken with Dee Team, who is the executive director of the Olala Center, and she said that they were starting a program where they were actually delivering food to some of their clients who were homebound because of the pandemic. And I asked her if we could create a partnership, and she was really open to it.
So Olala Center has a community health program which provides outreach, education, all kinds of health service navigation, connecting people to healthcare. So when COVID hit, we were seeing so many vulnerable people in poverty who were quarantined, had health concerns of their own, and were stuck at home with very little resources. And so we collaborated with food banks, we coordinated with Salvation Army, and then one thing led to another, and we ended up coordinating with Samaritan Health Services. And this partnership not only brings food to people, but it also brings people to people who are isolated.
With the protein prescription program through our partnership with Samaritan, the way it works is we deliver prepackaged foods that we get from JC Market, and when we will contact the client and we will deliver that food for him or for her. The other part of the program, what we do is just we refer the client to Samaritan, and sometimes we have to be more specific about the items that they need because of certain special diets that they may have. And then once we purchase those, we contact the client and we just deliver them to their doorstep, and that's how the program works.
One of our core values is building strong community partnerships. And this community partnership is really a great example of that because we have the foundation, we have the Olala Center, and we have JC Market Thriftway in Newport. And together we are really making a difference for our patients.